To go ahead and get started. Good evening and welcome to tonight's virtual town hall held by the members of the Board of County Commissioners. I'm Dylan Blaylock with Clackamas County's Public and Government Affairs Department, and I'll be coordinating public comments for tonight's meeting. Tonight's topic is mental health, addiction, and recovery, innovations, and community feedback. Joining us tonight is the full Board of County Commissioners, Chair Tootie Smith, and Commissioners Paul Savas, Martha Schrader, Mark Schull, and Ben West. My thanks to all of you for being here. Also joining us is Clackamas County Behavioral Health Division Director, Mary Rumbaugh. My thanks to you as well. Here is how tonight is going to work. In a moment, we will hear brief welcoming remarks from Chair Smith. Then we will hear a short presentation from Division Director Rumbaugh. After that, we will switch to the public feedback section of the town hall. At that time, we will take live comments over Zoom. I will also be reading emails that have previously come in to us or that come in to us now. You can email your comment in at any time during the meeting to clackonews@clackamas.us. But if you do, please do try to keep the email brief, as priority is given to those providing live comments over Zoom. Let me put that email address in the chat now. We'll go ahead and do that. Tonight's event will go until 7:30 p.m. or until we run out of comments and questions. Commissioners will have the chance to provide closing thoughts starting at about 7:15 or so. The session will be archived to YouTube tomorrow. First, I'd like to state that one of the reasons that this topic was chosen is because September is National Suicide Prevention Month. We'll drop in the chat a recent news piece from the county about our efforts combating suicide. The page features several links for resources. You'll also see several times tonight a reference to Clackamas County's 24/7 crisis and support line. If you or a loved one is in a mental health crisis, please call 503-655-8585, and we'll include that information in the chat as well, along with some other resources. Great. Now, just briefly, to set the stage for our discussion, a couple of definitions. Tonight, you'll be hearing a lot about behavioral health. Mary Rumbaugh is the Behavioral Health Division Director, and thus Clackamas County has a division devoted to it. But what is behavioral health? We're going to drop a definition in the chat below. But generally, health authorities describe behavioral health as a spectrum of behaviors and conditions encompassing mental health, substance abuse disorders, and more. Clackamas County's Behavioral Health Division connects residents with options to improve mental health and addiction to stress so they can achieve recovery, a process where people will regain the ability to live, work, learn, and participate in their community. Again, that definition is in the chat. And one last definition to share. Tonight, you'll also hear about recovery-oriented systems of care. A recovery-oriented system of care is a coordinated network of community-based services and supports that is person-centered and builds on the strengths and resiliencies of individuals, families, and communities to achieve abstinence and improved health, wellness, and quality of life for those who are at risk of alcohol and drug problems. That is a definition from the Substance Abuse and Mental Health Services Administration, and that will also be in the chat. So, good housekeeping. And with that, we're going to hear welcoming comments from Chair Smith. Madam Chair.
Thank you, Dylan, and thank you to all the members of the public for joining us for tonight's town hall with Clackamas County Commissioners. The topic, mental health, addiction, and recovery, is very important to this board. In April, the Board of County Commissioners adopted a resolution supporting a recovery-oriented system of care and responding to the addictions, mental health, and homelessness crisis. You saw the definition of such a system just a moments ago when it was shared on the screen. In that resolution, Clackamas County acknowledged that a significant and consequential portion of those struggling with homelessness also contend with mental illness and/or addiction. 2 weeks ago, this board produced a Clackamas Addictions Recovery Summit that brought together local, national, and international experts to help develop new solutions to address the addiction and drug abuse problems present in the county area. The idea for that summit actually came out of a board's annual retreat held earlier this year. This board knows that there are innovative ideas from all over the world that can help our community, and that's why we convene the summit. We're solving this problem the Clackamas way. We look forward to hearing from you during tonight's town hall, and if we don't respond directly to your question or comment, please don't take it as a sign that we don't care. We do care, and we can reach you by email as well. We just want to hear from as many people as possible. And with that, Dylan, I'll turn it back to you.
Excellent. Thank you, Madam Chair. Now, to follow up and provide some materials related to Chair Smith's welcoming remarks, we're going to share a couple more things in the chat. The first link will allow you to read the full text of the board's April resolution supporting a recovery-oriented system of care in responding to the addictions, mental health, and homelessness crisis. The second link will provide a quick summary of the recent Clackamas Addictions Recovery Summit. It will also include a link to the video of the summit. All right. Thank you. Now, Division Director Rumbaugh will provide a brief presentation. Director Rumbaugh.
Good evening, everyone. Thank you, Dylan, and thank you, Chair Smith and Commissioners, for inviting me to this really important conversation. I will note that I'm going to actually talk about quite a few resources. You do not need to write those down like what we have been doing. We'll actually put those in the chat. So I really wanted to start with talking about what actually currently does exist for Clackamas County residents, and many of these resources are available to any resident regardless of insurance, including those who might not have insurance. So we've already highlighted it. It's really important to know that we have a 24/7 crisis and support line, and that number is listed. And during COVID, we actually added the word support. We didn't want the community to wait until they were in crisis to give us a call. We actually want to avoid crisis, and we want people, whether it's the individual who's struggling or their loved ones, to give us a call. We're happy to consult. We're happy to talk about resources that might be available, including those resources provided by the county. The other important resource that we have for anybody in this community is the Clackamas County Mobile Crisis Response Team. So this is a 24/7 team. They respond in general without law enforcement. Sometimes they do, and they respond to all areas of our community, and they're addressing immediate mental health or substance use distress that's happening in the community. And the goal is to actually have those calls come to us and not have them go to 911. Our goal is to stabilize individuals in the community and not have them go to jail or the emergency room. And then the other resource that is available to anyone in this community is our Urgent Mental Health Walk-in Center. The address and hours are there. Again, this is a intervention, so anyone can walk in. Loved ones can bring the individual in. Will provide immediate crisis support as well as some short-term stabilization services for that individual. Next slide, please, Dylan. I also wanted to highlight that Clackamas County also does provide behavioral health services. So we do have our health centers, behavioral health clinics, one located in Oregon City and one in Sandy, and that phone number for referral is listed. And then we do have a general customer service behavioral health referral line. Again, the number is listed along with our hours. And this is a great resource. If somebody is just not quite sure how to navigate, give us a call. We'll help you. We'll certainly look up websites. We'll give you phone numbers. We'll even do warm handoffs to phone numbers and to other resources for folks who need it. So again, these are resources that are available to anyone who is living here in Clackamas County. Next slide, please. Some additional resources that are really our community-based resources or for individuals who are on the Oregon Health Plan. So on our webpage is a list of 17 providers who are providing substance use treatment and recovery services, anywhere from housing to peer services to sort of low barrier outpatient. Those resources are available again to anybody in the county. You can go to that page and you can actually just click on the link of the agency's name and it will take you right to their website. And then it's really important to highlight the resources that are available to individuals who are on the Oregon Health Plan. We have about 100,000 individuals who are on the Oregon Health Plan, and you're either enrolled in one of two coordinated care organizations, either Health Share of Oregon or Trillium Community Health Plan. And they contract with a full network of mental health and substance use providers here in this community, as well as in the Tri-County. So you're available to go to any of those providers that are on your plan. And it's really important that we share that information so that, again, we're happy to assist you, but there are resources really right at your fingertips, and you can do some easy searches for some specialties or particular types of services that you might be looking for or your loved one is looking for. Next slide, please. So we've already spoken about really the framework of of our commitment here at Clackamas County, as well as our Board of Commissioners, around really having a recovery-oriented system of care. So really looking at the existing services that either we provide or we have in this community, or the opportunity to develop those in the future. And recovery becomes such an important word for all of our conversation tonight. Recovery is possible. And if we are not building a framework in which recovery is sort of leading our decisions, then we're going to fall short in really serving this community, because we recognize that recovery is hard. It is not a straight line. It goes forward, backwards, left, and right. And so that opportunity to really build a community-based network of supports and services that's really based on what the individual needs, not what we've just sort of determined. Our job is to really create the continuum of services to really support the individual in finding what's going to work well for them, whether it's around mental health or substance use. Next slide, please. So how does this play out for us? So we really do need to think about challenges with mental health and substance use, just like we think about other chronic illnesses, and that we have to create systems that, again, are going to meet the individual where they're at, and that we're thinking really long term. So of course we need immediate interventions for folks who are in crisis, but we need to build the recovery community that's really going to surround the individual. So really beginning to talk about mental health and substance use, just like we talk about other chronic illnesses, health conditions that impact people's quality of life. So hopefully tonight we'll give some good examples too of our thinking about how we're going to really operationalize this recovery-oriented system of care, both what's currently happening today and into the future. Next slide. So as Chair Smith mentioned, we spent a couple of days with some experts sort of across the country, internationally and locally. And these are really just some high-level themes that we really wanted to take the opportunity to share from the Clackamas Addictions Recovery Summit. And I just spoke to this. I got in front of myself, as I always do, because recovery is possible, and we need to make sure that we are really leading with that. Again, we need to meet individuals where they are at. And part of tonight is really hearing from individuals about what they do need, so that anything that we're developing is meeting those needs. We know this, right treatment at the right time. That is not what we have today, other than if somebody is in more of an urgent or crisis situation. So really, when that individual is ready, that treatment is really on demand for them. Next slide. I think another really important takeaway is that it's not just housing, or it's not just services. It has to be both. So it is housing and services together. We know it's going to be the most successful for folks who are both struggling with mental health and substance use, and/or substance use, as well as housing. We also need to recognize fentanyl addiction is a game changer. It's a new ballgame for us, and we need to think differently about how we are addressing fentanyl in this community, and how sort of the delivery system is able to address it as well. And it would not be fair to not address some of the workforce challenges that exist today. And I think we heard that in the summit, both from the experts as well as our community members who participated. We might be able to build the best and the greatest, but if we don't have a workforce to actually hire and retain, and so that is going to be something that we need to be thoughtful as we're building capacity, that we also have the workforce to meet the needs as well. So that was an important theme, and really known to us today as well.
Okay, great. Thank you, Mary. I believe we have dropped all of the helpful info that Mary relayed right in the chat as she was speaking. So again, our thanks to Mary for that presentation. And with that, we are going to move into questions and comments. All guests are welcome to pose any questions or comments related to mental health, addiction, and recovery services offered by Clackamas County. But to help guide the discussion and just give you some ideas, here are 2 questions we'd love to hear answers about. So, for caregivers of those with mental and related illnesses, including substance use, how can we do better? And What can the county be doing to improve your and your loved ones' experiences as you navigate the behavioral health system of care? We will drop those in the chat as well. All right, if you have a comment to make, please use the raise hand function on Zoom. That could be at the top or bottom of your Zoom screen, depending on your device. If you're on the phone, let me see if we have anyone on the phone. We do have one, so it's on the phone. If you're on the phone, you can hit *9, and that lets me know you have a comment, and you can hit *6 to unmute. All right, let's see how many we get here, and I can make the recommendation. Oh, we've got 5 hands up, Madam Chair, given the time. I still think we can go for the normal 3 minutes for a time limit. Is that okay by you?
Yes, go ahead.
Very good. Okay, also I will be reading emails that come in. You can email your comment in at any time during the session to clackonews@clackamas, but do try to keep those brief. We'll share the email again in the chat now. And also, please do know that all email comments we receive will be shared with the board after this meeting. And please know that questions not fielded live tonight will be responded to by a county staffer. And with that, we will go ahead and get started. I see the first hand up is Casey Curry. Casey, if you could go ahead and unmute yourself, very good. And you have 3 minutes. Go right ahead.
Thank you, commissioners, for providing this opportunity. My name is Casey Curry, and I am a staff member with NAMI Clackamas, the local chapter of the National Alliance on Mental Illness. And mental illness has been a major impact on my family and our entire community. I'm going to speak for somebody who was going to speak tonight, as well as for myself. She actually has a family member who is currently in crisis, and she is having to call 988 at this time. Her comment was providing housing that is affordable and accessible is such an important part of addressing mental health. At NAMI Clackamas, the lack of stable housing is exasperating and mental health stability for at least half of our clients. We urge you to both keep working on expanding housing overall, as well as set aside a greater number of affordable housing units that are specifically designed for folks living with a mental illness. And my comment is our Clackamas County Mental Health Court remains a leader in appropriately handling ease where defendants have serious mental illness. Our Clackamas County DA's office works in close partnership with the public defender and the judge to achieve just outcomes in the courthouse. NAMI Clackamas recently started placing volunteers in both the mental health court and aid and assist court each week to provide information, resources, and assistance, especially for the family members of these defendants. We urge you to keep in mind that there is a significant overlap between mental health and the criminal justice system, and our county should keep leading the way on this issue. Thank you.
Okay, very good.
Thank you very much, Mr. Curry. We appreciate that. And don't be a stranger.
Thank you very much for that, Mr. Curry. Okay, we have a lot of hands up. Excellent. Next up is going to be Emily Martin. Emily, if you could go ahead and unmute yourself. There you go. You are on. You have 3 minutes. Please go right ahead. I'm sorry, Emily, we are not able to hear you if you are speaking. I did see that you unmuted yourself, so it might be an issue on your end. I will come back to you. Okay, we'll move along to Judith Steele. Judith Steele, if you could go ahead and unmute yourself. Very good, and go ahead. You're on with County Commissioners.
Thank you, Commissioners, for providing the opportunity. I live in the unincorporated part of Clackamas County, a part of Milwaukee near Gladstone. I serve as a volunteer president, board president for NAMI Clackamas, the local chapter of the National Alliance for Mental Illness. Mental health has had a major impact on my life and the life of several of my friends. I received tremendous amount of help through Clackamas County mental health, and also through NAMI when my daughter was ill. Unfortunately, the services provided throughout the county were really not enough, and she died. But they helped me even after she died, recovering a little bit from grief. I don't know that you ever completely recover. but I was so impressed by the assistance I received. I decided to dedicate a good portion of my life to helping others who are dealing with the same problem. Clackamas County NAMI is a grassroots organization that was started in 1978. And I believe we were the first in the state of Oregon. We are dedicated to improving the lives of people impacted by mental illness through support, education, and advocacy. We provide services 100% free of charge, and the people that are providing them have lived experience, so they really understand the problem. We provide classes, one of which I taught this year with another peer, and for family members and for peers who have mental illness. We provide 3 weekly support groups and 3 monthly family support groups, the peer support groups. We provide 3 of. And we also will be adding support groups specifically for women and LGBTQ and the Latinx peers this fall. We provide mental health presentations in English and Spanish to businesses, to just about anybody who listen. And are very effective getting those out, and are providing more this year than ever. We provide free one-to-one peer support assistance for clients. The demand for our services is ever increasing. And that's good because
Judith,
yes,
I'm sorry to interrupt. We're almost out of time. Can you
quickly? That's good because people are recognizing and ignoring the stigma, but we need your help. We need much more. Thank you so much for your time.
Excellent. Thank you so much, Judith, for sharing that. Okay, I will go ahead and add one question that we received via email, but that doesn't mean I don't see the hands that are up. So just keep your hand up if you would like to give a comment. One question we received from Judy. What support services can a mental health social worker provide for those with schizoaffective disorder who live semi-independently in private housing? I'm especially interested in face-to-face help, such as weekly visits, computer assistance with paying bills, and or dealing with various insurance companies.
Mary, you want to take a shot at that?
I think I can take a shot at that, Chair Smith. So some, but not all, mental health agencies do offer, in-home supports. A lot of agencies are sort of recovering and coming out of the pandemic, so they still offer telehealth and some in-office. But we recognize that in-home supports are really critical. They're often provided actually by case managers or peers, and they absolutely can assist with navigating the various aspects of the behavioral health system. So I think it's really important if you are seeking a provider that these are some of the questions that you either as a loved one or as the individual seeking services can ask about the array of services, including some of the in-home supports, because we know that, again, we need an array of services, that not one size fits all. I wanted to also just address the opportunity for assistance with a bill pay. So Clackamas County Social Services actually does run a money management program, or they can also offer volunteers who do a bill pay. They're called a bill pay coach. It's a great resource for somebody who just needs some assistance and oversight around the financial management, but that it's really in partnership, and we're not sort of taking that independence away. So I would encourage folks just to actually look at the Clackamas County Social Services page, and it actually has a really nice description of the money management program that they run.
Excellent. Thank you for that, Mary. And thank you for the email to Judy. Okay, great. Okay, next up, let's go to another hand. And we just shared the money management program in the chat. Thank you very much, Garrett. Let's go to Kim Oakes. Kim, if you can go ahead, and there you go. You're on for 3 minutes with County Commissioners. Go right ahead.
Thank you. So I've been a provider for about 8-9 years and a substance use provider. And I really feel that what we're missing right now is detox services and residential. We are doing great with outpatient services. We're doing great with peer mentors, but we're missing the continuum of care model that was built and, to meet the needs, especially like Mary, when you're in your presentation, you were talking about how fentanyl is a game changer. Well, us providers, we can get somebody into outpatient, but we can't get anybody into detox or residential. And so bridging that gap is not only burnout for us providers, because it's just sad in the world today, but it's also, we're losing motivation for our clients. We're there. I had a client on a wait list for residential services being number 135. It took him 2.5 months to get in there. And during this time, he stopped taking his Suboxone. He was full relapse mode after losing his assisted housing because he could not stop using and needed that residential care. I think it's crucial if we're going to get ahead of the fentanyl in any type of way is detox and residentials. And yeah, thank you.
Kim, I'm going to have Commissioner West comment on this. This is why we had the Addictions Recovery Summit, because we recognize there's a void in this, and that's exactly what we want to do. And moving forward, we're looking at. Commissioner West, would you like to comment?
Yeah, some of this is in my closing remarks. Kim, I'm a registered nurse. I've worked in this space, and I currently work in cardiology still. But you're correct. You're right on with the gaps within the continuum of care. And a lot of the recovery-oriented system model that we're adopting here in Clackamas County, it addresses that care continuum and looks to fill those gaps. So, for example, it often starts right on the streets, robust outreach, knowing who's in your community, knowing who's maybe has an addiction issue, or maybe they're camping in public spaces and being in their space to build those relationships. And then it's making sure that it's not a one-size-fits-all patient-centered model as you build those relationships and help work with that individual towards a system of change. Then we have to stabilize them once they're ready and they agree through that partnership with us. And that is detox, that is mental health support, that's some economic support, that's stabilizing the individual right where they're at and meeting those basic needs. Then we have to get into the pre-treatment piece. They may not even be ready for treatment yet, but that's some low barrier, safe places to go. Maybe it's for 90 days to get those needs met. And then the next piece of the care continuum is recovery housing and some transition there, where we actually help them get in a place if they have an addiction issue or need further stabilization, where they're working on recovery for long term. And maybe it is residential, it's not necessarily outpatient, but we're doing more intensive work with that individual for 18 to 24 months to get them stabilized. Then we're transitioning them to potentially permanent housing as part of the plan, where they're getting peer support along this whole care continuum, but also maybe they're living with other successful peers in a small peer group and permanent housing, as they also are getting integrated within the workforce and getting some education or employment skills along the way also. So you are right. It is very much about prevention. It's awareness. It's shelter beds. It is detox. It is working hopefully with treatment courts or drug courts through the justice system to help people get what they need, long-term recovery, and really focusing on people being self-sufficient. That's the goal. A whole care continuum, and at the end, someone is self-sufficient. And building up their capital again as an individual. So that's part of that recovery model. And I know that this Board of County Commissioners, I'm pretty sure I can say this, is completely motivated and driven to help fill the holes within the care continuum. I mean, and not allow people just to cycle in an endless despair and not get the care they need. It's not moral to do that. And so we're trying to be outside the box, and that's the Clackamas County way the chair talked about. And that I kind of gave you maybe a quick snapshot about what the care continuum looks like. We're acutely aware and focusing resources directly to the issues that you are mentioning.
Thank you, Commissioner Woods. And Kim Oakes, really thank you for that. We didn't get into this horrific situation overnight, and it's going to take us a while to get out of it. And we're working as fast as we possibly can now that we have direction of what's needed. I think we're going to create a system that can be copied throughout the state of Oregon by the time we're done with this. But thank you very much.
It's just one more last thing. is, as an agency that has the availability and the space to kind of work on the continuum of care model that you guys are talking about, how do we get more involved with that and being providers of that?
Mary?
So great question, Kim, and I believe your agency is already, I do host a monthly substance use community provider and peer, really a networking sort of opportunity to share what's happening here at the county, but also to really hear across the continuum all the amazing things that you guys are doing. And I just want to really highlight, Kim, that you and your colleagues, you are keeping this work moving forward. And I know it's been a rough 3 years. And I just, every time I'm in front of our providers, I want to just acknowledge how hard they have been working and will continue to work. And it is not easy right now. So certainly reach out to me if you're not already represented at our monthly meeting. I'm happy to the list. It's about 85 folks, so it's a pretty engaged group. It's pretty exciting. So would love to have your voice and perspective there.
Excellent. Thank you for that, Mary and Chair Smith and Commissioner West and Kim for the question. Great. Okay, next up, Abigail Wells. Abigail, if you could go ahead and unmute yourself. There you go. You are on. You have 3 minutes. Thank you very much.
Hello, my name is Abigail Wells. I work for Northwest Family Services, and I'm a prevention and community public health department manager. I wanted to thank you guys very much for being here and holding this event and also holding the summit. I just wanted to quickly say that one thing that we are kind of forgetting in the continuum of care is prevention. Prevention is it's the key to helping with substance use disorders and catching them before there's the need for treatment and recovery. Somebody gave a really good example the other day. They said it's like planting a seed, but not preparing the soil and not preparing the water and not doing the things that you need to do in order to keep the plant alive and to grow healthy and strong. So I just want to keep it in your minds that prevention is so important and really a vital thing that we need in our community more of to help the problems that are present because of substance use disorders. And that's everything. Thank you.
Thank you, Abigail. That's why this Board of County Commissioners voted to refer Measure 110 on the May ballot and asking the governor to call a special session and asking the Clackamas County legislators to redo Measure 110, to amend it, to and help us get these drugs off the streets. And that goes right to prevention. Hopefully you can support that effort as well. And you're right, we've got to get these drugs off the streets. When they decriminalize meth, heroin, amphetamines, and now fentanyl, there's nothing really law enforcement or any of us can do, because we will always be behind, because these drugs are just horrifically addictive, and you know that. And thank you for offering that up. Commissioner Schrader.
Well, thank you so much for mentioning that, Chair. I also wanted to mention that there is a group out there headed by Max Williams, who actually was a legislator who I knew back in the day and was the recent director of the Oregon Community Foundation, and he has since stepped down. But what he is doing with the business community and other thought leaders across the state and in our county is moving forward with what they're calling the Measure 110 fix. And that really is taking a look at making sure that public safety is part of the continuum, that indeed people need to be able to have access to drug courts. They need to have access to a public safety system that enables them to get a direct line to the treatment that they need. So I would hope that everyone is aware of this effort. I think it's gaining a lot of momentum, not just in our county with the Clackamas Way, but also throughout the state. And they are also pushing to make sure that if something does not happen in the February special session that's going to be happening, that they are going to move forward with an initiative to actually change it. So public safety becomes part of that whole continuum. Thank you.
Mr. Savas, go ahead, Dylan. You can call in, folks.
Sorry. Okay, very good.
I was just wondering if Mary Rumbach could answer Abigail's question as it relates to what's currently available for prevention in our network of care currently.
So our Children, Family, and Community Connection division, they do a lot of middle school and high school prevention work. We also contract actually with Northwest Family Services to do some for high schools, quite a few high schools, I believe 7 high schools across the county around what we call A&D outreach and engagement. So we're really trying to get to the youth before they're making some of those hard decisions. And then really, Commissioner Savas, I think wherever we can continue just to educate, provide, trainings around how do you recognize, in particular, this is more around mental health, but it's not usually a siloed challenge that people have. Wherever we can get folks trained and educated to be able to understand the signs and warnings, and then have some of the basic tools to get folks help. So we have prevention. It's never enough, and it's very hard to measure, right? It takes a long time to show that prevention works, but it's so important that we continue to invest in it. So we have it, it's not enough, and that will always be an opportunity for us to expand and grow in our prevention efforts, both here at the county, but also in partnership with our community-based organizations.
All right. Excellent. Thank you for that, Mary. And thank you for the question again, Abigail Wells. Okay, I see 4 more hands up. We will get to all of you. If you have any, if any more members of the audience have a question, please go ahead and raise your hand. Real quickly, we will go to an email that we received. It's from Mindy. Women-only detox and rehab centers are almost non-existent in Oregon. Even if there were such a place, most working families can't afford what's left from the shortage of insurance. Why is there not more help? We spend thousands of dollars to talk about how to spend millions and never get anywhere. It seems to me you could pay the out-of-pocket costs and save money and help so many people. Again, it's from Mindy. All right, and let's go to Mary Clark. Oh, sorry, Commissioner West, did you have your hand up?
I want to just, was that Mindy's question? Am I understanding? Is that?
Yes.
Mindy, you were, hold on, I turn the lights back on. Mindy, you are correct. That is a real problem, is that we have safe spaces for the different sexes and places for people to go within community that they belong to get the care and treatment that they need. Some of that is capital issues of having the infrastructure to have those resources available to us. I just want to let you know, please be a little bit patient with Clackamas County, but we're looking at trying to solve those specific issues that you bring up, to bring more specific resources available to people, and to get better access to people where they're at and have multiple points of entry within getting care. So we are looking at that right now and trying to be innovative, and we're acutely aware of your question. I just want to thank you for bringing it forward.
Very good. Thank you.
In addition to that, the Northwest Teen and Adult Challenge is seeking to establish a women's residential treatment center, and this board of county directors gave them a sizable grant, pretty good 6-figure grant, to try to find a building to put one in. So maybe you can help them find a building if there's anybody out there. And that seems to be what's at issue here, is finding the real estate and a place to put people. It's scarce, but thank you for that question.
Very good. Thank you, Chair, and thank you, Commissioner. Mary Rumbaugh, I'm sorry, did I miss your hand go up? Respond to that? No? Okay, very good. All right, excellent. Thank you again, Mindy, for the email. Okay, next let's go to Mary Clark. Mary, if you could go ahead and unmute yourself. Very good. You're on for 3 minutes.
Thank you. I'm Mary Clark, and I worked and lived in Clackamas County for 40 years, and I'm here tonight representing NAMI Clackamas. I'm on the board. NAMI Clackamas has recently begun providing mental health classes in the Clackamas County Jail. The goal has been to provide information to help adults in custody increase awareness, gain personal insight and understanding, and ways to self-evaluate their strengths as well as their challenges. Skill building tools for individuals to continue working on their own behavior have been provided. The response from both the participants and jail staff has been overwhelmingly positive. We are grateful to be able to expand and make permanent these classes and provide more tools and resources for individuals while they're incarcerated, as well as support to seek follow-up assistance once they're released. I urge you to keep in mind that there is a significant overlap between mental health and our criminal justice system. Thank you.
Okay, very good. Thank you for that, Mary. Appreciate that. Next up is Troy McChesney. Troy McChesney, if you can unmute yourself. Very good. And you're on with County Commissioners for 3 minutes. Go right ahead, please.
All right. So my name is Troy McChesney. I'm a person in long-term recovery. I'm looking to establish, I have a sober living house recovery home in Clackamas County, and looking to establish a partial hospitalization intensive outpatient program. We do need more residential. We do need detox for sure when we're coming to the opioid crisis, in particular with fentanyl. What we also need is longer term care for individuals. And so what we need is we need to be able to have these systems in place where somebody is going to have the best outcomes possible. We're looking at 6 to 9 months is where we see the evidence-based outcomes are greater at that moment in time. Utilizing an outpatient program, a longer term day treatment program, while having the recovery housing in place as well, is something that I believe would be, honestly, it would be a game changer for what we're able to provide. Get them through detox, get them through the residential, and then be able to provide these services for 4 to 6 months and have them in the recovery housing. One of the things that I've run into as I'm building this program, which is going to be on 82nd Drive, we already got the space. The certificate is with Oregon Health Authority. We're waiting for the approval. One of the things that we've run into as barriers, because we're funding this out of our pocket to be able to establish this, is with Oregon Health Plan, the reimbursement rates are just not high enough for us to be able to stay in business, to be able to provide these services for people. And without having the funding or the resources available, we wouldn't make it to be able to provide that for the county. So I guess my big thing is that if there is a possible way to look at higher reimbursement rates or adding some additional funds to that, or if there's even some grants for for-profit facilities that would be able to be beneficial, or even for the recovery housing component of it, right? So we're putting them in a house. We got 24-hour wraparound support. We're giving them the treatment that they need. We have a medical provider right on staff working with the mental health medications and all that. It's just we can't afford to do it with what the Oregon Health Plan offers. So that's all I have.
Okay, very good. Thank you very much for that, Troy. I see Commissioner Schrader, you have your hand up.
Yeah, thank you for that, Troy. One of the things that in preparation for tonight that I compiled and actually was compiled by the National Association of Counties is essentially a chart of 5 types of funding sources: federal, state, and county governments, and non-governmental sectors. And essentially what this resource does, it sections out federal funding broken out by federal agencies. And most of these agencies can provide a direct or pass-through funding to counties. And I think that maybe it might be helpful. I know that Mary and our staff here at Clackamas County is very adept at accessing these fundings at all levels, but I'm wondering, colleagues, if there is a way that we can get this resource, county funding opportunities to support community members experiencing a behavioral health crisis, out to all of our partners. Because looking at this, it has the Department of Justice, the Department of Education. It has funding streams from a few of the other agencies, U.S. Department of Agriculture, for instance. And what this does is it gives you the resources and gives you an idea of how you can start weaving together funding streams for the types of projects that you're talking about, Troy. So I was hopeful, Dylan, I can supply this to everyone and maybe make it available to the folks who have called in tonight. Thank you.
We can certainly do that, Commissioner Schrader. Oh, Commissioner West.
Troy, I think there's probably a lot of alignment in the work that you do and what the county is trying to do. If you'd be willing, or maybe Dylan, you could share, I'd be willing to talk to you offline and learn a little bit more, and then maybe see if we can coordinate and put our heads together to help you guys out and feel a way to be more viable and be good partners with you and learn more about what you guys are doing. If Dylan, you could share my contact information with Troy, or maybe Mary's too. I don't know, maybe, I'm sorry for throwing you out there, but I think this warrants a larger conversation outside of this town hall, but we want to engage with you.
Of course, Commissioner West, I'm happy to do that. And again, I will relay all of the emails and connectivity information for the respondents to all the commissioners after this meeting. So all the contact information is a much better way to say it. So thank you. Okay, I see Nick. Thank you very much for that, Troy. Very good. I do see we have Liz and Pam and Bo with their hands up. We will get to each of you in one moment. Let me read another email from Natasha. How is the county addressing the stigma associated with mental illness and addiction in the context of homelessness? And what steps are being taken to promote understanding and compassion within the community? Maybe that's best for Mary. Oh, sorry.
I will defer to Commissioner West and I'll follow up.
Mary, go ahead. I'll go after you. Go ahead.
What I would say just very quickly, one, thank you for addressing that. We actually know that one of the reasons individuals may or don't seek services for mental health and substance use, in particular, houseless or housed, is because of stigma. So I mentioned this a little earlier. I think it's very important, and my division in particular helps lift up this work. It's really important that we get the tools out there for our community members so that they can really be educated and understand and just have awareness of folks who may be struggling. It's sometimes very obvious, and sometimes it's not. As we know, depending on which statistics you're looking at, 1 in 4 or 1 in 5 individuals will struggle or are struggling with a mental health condition as we speak today. That's a lot. And we know that people are not seeking services. So one resource is gettrainedtohelp.com. Those are free service, free trainings for anyone who lives or works in Clackamas or the other 2 counties. It's a partnership with Washington and Multnomah. It's an amazing resource. It's basic tools, and it really empowers people to learn how to ask some of the hard questions and then know how to get individual support. So that's one way we are really trying to break down stigma, because we know that stigma is resulting in folks not accessing treatment, at least not in a timely way. So thank you for that question. I'll hand it over to you, Commissioner West.
I think another interesting perspective that we want to take is we have to be bold and a little bit aggressive in our outreach to find the people that are in a place where they don't feel like they have a voice any longer, or that they don't even know where to speak up to, or they just feel like they're drowning in the despair or the darkness that has encompassed them. I believe there is no dignity in addiction, and allowing people to waller in addiction is not compassionate, and not being aggressive and treating this like the crisis that it is in the metro area is immoral, and allowing people to have an endless cycle that has no hope is immoral. And I think that the best way to combat the stigma is with hope, and letting people know that we see intrinsic value and worth in them, even though they may be struggling with different issues and behavioral issues or addiction, but we see worth, value that's intrinsic to who they are as a person, and there's potential there that's worth fighting for, and letting that be the message of love that we're coming from, that's our goal. And being patient-centered, patient-focused, and tailored in our approach, and providing real resources that hopefully will fail less people, because for far too long in the metro area, we've had a lot of different things and a lot of money spent, but we haven't had a lot of success, and we don't have a lot of trust. And I think we have work to do, not just as a local government, but as providers in the region, in that sphere. So I think it starts with robust outreach. It starts with being honest. And sometimes it's, we can't be paralyzed to go give people help in the lifeline they need because of fear stigmatization either. Because there is, once again, no dignity in addiction. And so I think that there's this balancing act that we have to do. But as a governmental agency in the Portland area, all of us in the Portland area, specifically in the state of Oregon, and we have a lot of broken trust and a lot of work to do. So people can know that there actually really is hope and opportunity available to them to get self-sufficient and healed.
Okay. Very good. Thank you, Commissioner West, and thank you, Mary. And as Commissioner West was speaking, we also shared the Get Trained to Help link that Mary referenced a moment ago. Okay, next up is going to be Liz Spitzer. Liz, you can go ahead and unmute yourself. Very good. You have 3 minutes. Go right ahead.
Thank you, Dylan, for hosting this for us. And thank you, commissioners, and Mary, our behavioral health director of Clackamas County. Thank you all for giving us the time to speak. My name is Liz Spitzer. I live and work in Clackamas County, and I also volunteer with NAMI Clackamas. Professionally, I am a trainer for mental health first aid, assist QPR, and also provide additional trainings and things related to resiliency and other interpersonal development skills. I've been working with NAMI quite closely in regards to the 988 mental health crisis line. And since its launch in July of 2022, it's been growing each month. More people are aware of 988 and more people are calling and texting when they or their loved ones experience a mental health challenge or crisis. I have seen this in the classroom when people have talked about it. What people are appreciating is that they're connecting to trained professionals and that they're no longer going to a dispatch center in which they feel that people are not able to connect or understand to what they're experiencing. As you recently are aware, in June, we approved, the legislation of Oregon approved significant expanded funding to help keep up with the continued growth of these calls, and that's been great. This new law also, as you are aware, expands the state funding for the local mobile crisis response teams, which we urgently need in our Clackamas County, and I know that we have them. I recently attended a conference in Bend. It's called the Behavioral Health Summit, and they did the Mobile Crisis Academy training there. First of its kind, I believe. It was a sold-out event, if you will. There was a lot of people there. One of the sessions that I participated in was about learning how people are going to respond to a mental health crisis and how people are going to engage in that together, the police officers and mobile crisis teams. And they were discussing, like, what does that look like for the future? One of the things I heard is that people are uncertain. Professional police officers and dispatch and mobile crisis teams, they are uncertain about what that's going to look like in the future as the demand on this line, 988, is increasing. Something that I would like you to think about is how, when you're pursuing the state funding and expanding our local mobile crisis response team to serve those in need, please also engage team players who are going to be instrumental on helping these different multitude of agencies function together so that people aren't lost in the middle. Or I'm thinking of a bowl with a lot of different holes in it. I can't pronounce it well.
Liz, we do have to wrap up here.
I am done. So I just want to say, please be mindful of all those who are engaged in it. Thank you.
Excellent. Thank you, Liz, for that comment. Mr. Savis.
We have a number of people that are calling in from NAMI, and maybe Liz or someone else could probably answer this question for me. But from your experience and the people you treat and interact with mental health or behavioral health needs, how many of them are housed and how many of them are unhoused? It seems like the treatment for people with behavioral health issues are going to be, perhaps, I'm sure, unique to those people who have maybe drug addiction issues. So often they get conflated and maybe there are times where people have both, but I'm just wondering what population, housed or unhoused, are a majority of the clients you serve?
That is a great question, Commissioner Paul Savis. I am not qualified to answer that. I believe our executive director, Dave Hunt, may be more qualified. And I also know that Casey Curry, who we heard from earlier, works directly with clients in that regard. So perhaps, Dylan, we can ask Dave if he's available.
Yeah, if either Dave Hunt or Casey Curry can email that information in, then I'm happy to go ahead and share it. Oh, never mind. It looks like Dave is right here. Dave, if you want to unmute, go ahead. Go ahead, Dave.
It's actually a great question. I just asked Casey that earlier today, and she said definitely a majority of our clients that are having mental illness challenges are suffering from some kind of housing instability. In fact, the answer she gave me was somewhere between 50 and 90%. So it's not 100, definitely more than 50. And some of them, it really is a need for that kind of not only stable and affordable housing, but something that has some supports in place to help them deal with their mental health challenges. In some cases, it's just straight lack of access to safe and affordable housing. Hope that's helpful.
Excellent. Thank you very much. Thank you for that, Dave, and thank you for that, Liz. Okay, very good. Ooh, looks like we have about a little over 15 minutes left, so do get hands up. We have a bunch of hands up right now. Let's go through them. Pam Pierce. Pam, go right ahead and unmute yourself. Very good. You're on. Go right ahead.
Thank you. Pam Pierce. I've lived in Clackamas County most of my life. I'm a person in long-term recovery. I've been sober for 28 years, and I lead a prevention organization in West Lynn. And I currently have, and when I say prevention, I'm referring to upstream prevention. So making sure that the disease, the disorder doesn't happen or doesn't start to begin with. And I currently have 165 young people ages 14 to 18 that regularly participate in the student-led club at Westland High School. Because again, it's educating people on what will happen with if they use substance use, understanding the genetic component. And I've been doing this work for roughly 7 years. In the first few years, I paid for it myself because I believe prevention is the cure. And until people understand what prevention is, prevention needs to be knowing how to ask for help. And so, again, I feel passionately about this work and making sure people have the information they need to protect themselves and to prevent having crisis with substances. I wanted to thank Clackamas County. After working in this profession for a few years, Clackamas County was the first funding that I received and continue to receive, which I'm grateful for, and I really enjoy the partnership. And in 2002, I was awarded a drug-free communities grant, which brings in about $625,000 to the county, to me, to be able to do prevention services. But something I would consider a win. Again, prevention is the cure. And I sit on a lot of committees, a lot of groups, a lot of boards, and we have a hard time defining prevention, and I can't figure out why. And so I just ask, when you are tackling this enormous concern that our state has, to remember that educating people on what this is, telling them the truth, prevents it from happening, because we have to stop the customers or this doesn't end. It just gets uglier. And I'm speaking as a person who's affected by the disease. The disease is powerful. But thank you for your support. And again, I just urge you, when you're thinking about this, if you're not talking about prevention 50% of the time, Oregon, it's not going anywhere. Thanks.
All right. Thank you very much for that, Pam. Appreciate that. I will also mention, just Commissioner Schrader, I forgot to mention a minute ago, we did end up sharing in the chat the county funding opportunities to support community members that you referenced from NACO. Community members experience a behavioral health crisis. Very good. Just want to let you know we did that. Just took us a bit. Okay, next up is Bo Brinson. Bo, go right ahead and unmute yourself. Very good. You are on. Go right ahead.
Hey, thank you, Dylan. And thank you, Board of Commissioners and Mary, for your time. My name is Bo Brinson. I'm Events Director with Oregon Recovers, and I'm a peer wellness specialist. And I have utilized services here in Clackamas County. I live here. But I've also been on the receiving end of the negative parts that I've received from law enforcement, which brings me to, part one, or one of my 2 questions. So also, I'm a vice president of the Mental Health and Addictions Council. So thank you all, Board of Commissioners, for your signatures and allowing me to be of service. Me being a person of color makes it difficult, I feel, sometimes to be in Clackamas County. So I wanted to find out if there's any numbers when it comes to law enforcement and issuing the Measure 110 tickets. And then the second one is what budget allocations or resources are dedicated to addressing racial disparities in the criminal justice system and providing equitable mental health and addiction support, if that makes sense. So I just want to make sure that I always cover that, because being a person of color and have, been pulled over for being a person of color, that's just been my experience. I want to make sure that I am in positions on boards and things like that to make sure that a voice for people that look like me are spoken. Thank you.
Okay, excellent. Thank you very much for that, Bo. Right, next up is Teresa Melville. Teresa, go ahead and unmute yourself. Very good, and you're on with County Commissioners. Go right ahead.
Thank you. My name is Teresa Melville, and I am Clackamas County born and raised. One of the things that I have watched throughout my lifespan, sorry, I have a lot of dogs and somebody just showed up, is one of the areas we continue to lack is support and services for that concept of prevention within our youth, within our schools, within the community. And my question is, since prevention is the foundation and the cure for addressing the mental health and substance use dependence crisis we are facing, what steps can we look forward to the commissioners taking in improving access to resources for our youth within our schools and our community? Did that come across?
I don't know. Mary, did you want to take a, Commissioner West? Oh.
I'm not sure. I'm not sure who's going to jump in. Part of this, I think that at least within the last 9 or 8 months, the Board of County Commissioners absolutely made prevention and campaign awareness, awareness campaigns, a focal point. It's part of that continuum of care that we've talked about. Pam Pierce has been an amazing partner within the school district, specifically at Westland High School, has had some great events. That's working with the youth. That's also working in prevention within the hospital systems, families specifically, being mindful about ways that we can get downstream and looking for creative solutions to do that. But Teresa, I think we're in full agreement that the prevention piece is absolutely necessary. The problem is that we have a mountain of cheap and easily accessible fentanyl at it takes $1 to get high, and that amount can kill you, or cause you to OD. And so we have a lot of supply, and it's so addictive that the only way we can battle it on a local level is at a demand piece, ending the demand right in that chain. And so going downstream and being explaining what fentanyl is, explaining like your Adderall in high school may be laced and dangerous. You may be a normal teenager just experimenting and doing something with your peers, and it could end your life, right? And so just I just had a conversation with my son about what Narcan in his school is like and why it's important, and how to spot fentanyl in his school, because it's everywhere. We just heard about a little baby choking and ODing on a fentanyl foil in the Portland area this week, and thank God that baby survived. But you're right, like we have to figure out how to get more downstream with it, and not only are we trying to do that, we're also listening if anybody has any great creative ideas on how to do it better.
Oh, excellent. Commissioner Schrader, go right ahead, but you are mute.
Thank you. I think Ben is right on target with that. Another thing I'd like to mention is we do have in this county school-based health centers. That is where one of the other opportunities to improve access to quality physical, mental, and preventative health services. They will care for children and adolescents, regardless of their ability to pay, and they ensure services are age appropriate. And they keep students in class essentially and ready to learn. But part of what they do is they can be a nexus and are a nexus. I believe Happy Valley, Sandy, there is a list if you check our website of some of the schools that have these healthcare centers. But a big part of their role is prevention. And when they get an inkling that you have a student that is having an issue, they can actually help move that student to where they need to be for prevention purposes. So, and I don't know if you can find the links for those healthcare clinics, but.
Barry, you might be able to speak to this, but isn't there a great Gladstone program also at the high school that's really innovative and cool that we have helped get some funding to? I don't remember enough off the top of my head to speak to it, but you probably do.
Yeah, I believe that's a partnership with actually our local juvenile department. And so, yeah, there's some really innovative things that are, I think, happening, and what our opportunity is to better understand those innovative opportunities and think about how we spread it, because we also have 10 school districts with unique needs as well. And so we really should take some best and promising practices and figure out how to get it really into other areas. So yes, Commissioner West, there are some innovative stuff happening.
And that Gladstone property assesses and helps with mental health issues like depression, suicide prevention, and specifically more that mental health piece. Not necessarily totally addiction, but it's been, from what I can tell, all outcomes are really positive with its success with of the county.
Okay, excellent. Thank you all for that. And thank you to Teresa for the question. Next up is going to be Amy Johnston. Amy, go ahead and unmute yourself. Very good. Go right ahead.
Thank you so much. Thank you, commissioners, and Mary Rumba. It's so nice to be here tonight. I work with Todos Juntos, and we are a nonprofit that works in the school districts in rural Clackamas County and 4 cities, looking to make sure that we are. Oh, it said it lowered my hand. I'm still going to talk. Hopefully you can hear me.
Yes, just go right ahead.
All right, awesome. So we work in prevention. We work with coordination. We have family resource advocates. And one of the things, I'm a former teacher, one of the things that I've also noticed since COVID is how much our students don't believe that our communities care about them. And what we do is we really work to build those connections, help them find places that they belong, things that they love and care about, so that they remember who they are and they remember the power and potential they have in our communities, so that they don't turn to substance abuse to feel as if they have something that matters to them, that makes them feel special and important. And so we partner with other local nonprofits. We've been long partners with the county, and we really appreciate that support. But what we are looking at as we move forward is our resource coordinators, our family resource advocates are looking more and more for mental health resources. That's one of the #1 requests we get from the schools that we work with, especially as we have bilingual family resource advocates to help all of our populations, as many as we can reach. And I really love, what are we doing for our youth? The question that came right before is, how are we working at this? And as Mary Rumba said, it's never enough. Unfortunately, with prevention at the level that we are isn't really sexy. We can't look and say, look, we gave this person a sphero-robotics class and they never did drugs. We don't have those numbers. And so it may not look as interesting. It may not look as like, hey, this program has served 300 people and helped them turn their lives around, which is brilliant. And we need so much of that. But starting with the kids from the youngest age, letting them feel like they are valued and important part of our communities, with people who want to support them, help them find job training, help them connect to things. Like we take kids to visit welding shops, to explore creative writing, and just to explore all the possibilities that are in the world, instead of focusing on the negative and all the messages we get that say the world isn't a great place. And so I really appreciated hearing your message tonight about meeting people where they are and looking for those positive ways to reinforce the good that we do as communities and the good that you do as commissioners to help us guide our communities to be stronger and better together. So I really appreciate that. And I really appreciate your continuing support of what we do at a level where the numbers may not be as sexy and interesting, but the value in what all of us are doing as partners together to
Amy,
help
we probably have to leave it there.
is strong. So thank you.
All right. Thank you very much, Amy. Appreciate that. Okay, looking at time, we probably have time for one more. So Simon Fulford, go right ahead.
Chair Smith, thank you so much for chairing this town hall and the commissioners for being here tonight. Simon Fulford, Parrot Creek's executive director. You've already heard from one of my great colleagues, Kim. I really just wanted to kind of respond also to Commissioner Savis's question and what Pam Pierce said. The youth, we've been working in Clackamas County for 55 years. The youth who are accessing our mental health outpatient and our substance use disorder treatment, the vast majority of youth are currently housed. And yet there is still a real complete lack of services for those young people. And so not addressing and adequately treating and then supporting children and teens who are struggling with mental health and substance use needs directly leads to adult homelessness, chronic addiction, and severe mental illness. So yes, we have to address the crisis on the streets, and at the same time, we have to invest in treatment supports and prevention programs for youth. So thank you for really paying attention to these issues and focusing on that too. Thank you.
Excellent. Thank you for that, Simon. Chair Smith, I think, do you want to take one more or not? It's 7:13. What do you think?
Yeah, go ahead.
Okay, we'll do one last one. Looks like Zachary Pakal. Sorry if I'm getting that wrong. Zachary Pakal or Zachary Pashal. Go right ahead. You are on.
Yeah, thank you, guys. My name is Zachary Pashal. I'm the program manager with Youth Era and the Clackamas Drop in downtown Milwaukee. And we too work with a lot of students from Milwaukee High School, Academy of the Arts. We have students from Gladstone and others that come in from that come into our area as well. And we do one-on-one peer support, and a lot of our youth who come in, like last person just said, are housed, but they're still looking for support services because they are having, mental health challenges. But we're a free to youth ages 14 to 25 years old. And I'm still kind of new to the community here, but I think we're all trying to help make a difference. So that's all.
Excellent. Thank you very much for that, Zachary. And thanks everybody for calling in tonight. I think we're going to go ahead and leave it there to give enough time to commissioners to give parting thoughts. Before I pass it to Madam Chair, I would like to thank her, the other commissioners, and Mary Rumbaugh for joining us tonight. If you have further thoughts that you would like the board to know, you can always email them at bcc@clackamas.us, and we'll go ahead and put that address in the chat now as well. Lastly, if you would like to be kept aware of these town hall notifications, please be sure to sign up on our email updates page. Specifically, the monthly e-newsletter or the Board of County Commissioners list should do it. The latter list receives a weekly email about what the board has lined up that week for policy session topics and business meeting segments. And we'll drop that web address in the chat now. That's it from me for tonight. With that, I will pass it to you, Madam Chair.
Thank you, Dylan. And thank you all for contributing, calling in, giving us ideas, and telling us about your stories and what you do. It's very valuable information. With that in mind, I'm going to go to the commissioners. Commissioner Savis, you're up.
Yeah, appreciate everyone's participation in this conversation tonight. And obviously the title and the focus has been on addiction and recovery. And it's not uncommon to have conversations weave into or get directed to things that are maybe not necessarily in that understanding or space. And that, number one, behavioral health, and asking the question about whether those people are housed or unhoused. An article last evening that I found is out there nationally and locally about the growing population of elderly folks that are falling into homelessness. And whether it's stigma or whether it's stereotyping, I think there's a misunderstanding that all people, and it's certainly not true, that all people that are homeless have either drug issues or mental health issues or behavioral health, whatnot. That's not really the case. Economic homelessness is driving people out on the street, and then they become either victims or they fall into mental health, behavioral challenges, and or drug addiction challenges as well. So I totally agree that prevention is really, really important, but on a number of levels, not just prevention as far as educating people on why not to do X or X, but also prevention as far as keeping people housed. It's a vast, complicated challenge we have, but I appreciate everyone's input in here, but just recognize that everyone's case is unique and we need to be able to treat those particular populations as best we can. But we rely upon the state to really, for the funding and the treatment and the healthcare system, for a majority of the funding for people that are housed, which actually having a number of these challenges. A majority of people with drug addiction problems and mental health, behavioral health challenges are housed people, not unhoused. Thank you.
Thank you, Commissioner Shull.
Yes, good evening. Prevention is going to take a full spectrum approach to addiction, mental health, and the homelessness that it causes. It's going to take all levels of government to work on this problem. At the county level, to make a difference, to increase recovery, treatment, success, we have some challenges. One's Measure 110. The other's the power of fentanyl, 1,000 times more powerful than heroin. Will we need the ability of our courts to order people into treatment? And on funding, or funding last past the current measures when they expire, we're going to have to plan for a lot of funding for detox recovery and long-term housing. At the state level, our legislature must keep pressure on 110 to repeal it or modify it, and continue pressure on changing land use restrictions that cause property to be too expensive and housing to be beyond the reach of many of our people. Oregon land use laws contribute to homelessness, and that contributes to mental health and addiction issues. And the federal level, we need to ask both senators and our 6 representatives to the U.S. Congress to change current government policy. We need to see them control access of these killer drugs across our border, and also to stop the actions of some of these cartels that distribute these drugs up to our area. We must look at a full spectrum approach to this problem. And also, I like to remind folks that the staff at Clackamas County is standing by to receive your phone call should you or a loved one need help. Asking for help is not a weakness, and every one of us out there in this county can have a better life. I'd also like to thank everyone in the county who help in our clinics, our hospitals, in addiction and mental health and recovery efforts, and also for a thank you to all of our nonprofit partners. And I thank you all for your hard work and dedication and compassion. Thank you very much.
Thank you, Commissioner Schrader. Martha, you're on mute.
All right, I just unmuted again. I stay on mute because, as Commissioner Shull knows, sometimes I have barking dogs in the background. They're quiet right now. Here are some of my parting thoughts. I believe Clackamas County has a significant role in providing preventions and early intervention services that focus on on not only the environmental and social conditions impacting community members, but also really impacts their health and wellness. Community members with unmet needs of this kind face challenges such as housing, employment instability, untreated medical concerns, prior interpersonal trauma, unsafe living conditions, and lack of access to basic necessities. So it is essential that as we work through this problem, as we heard today from a number of the folks that spoke, that we really look at this as an upstream way to do this. Prevention, I think, is going to be incredible. So what do we do to help our constituents who are struggling with addiction, a lack of housing, trauma, medical issues? We can offer housing solutions such as crisis transitional or long-term housing, employed trauma-informed services, and support students with school-based mental health programs and increase access, actually something we haven't mentioned tonight, through expansion of things like telepsychiatry and other approaches. One of those approaches, and I hope that my colleague Commissioner West will talk a little bit about this, is the model that we saw in San Antonio, Texas, called Haven for Hope. It is actually a larger community response to homelessness, mental illness, unemployment, and it is a recovery-based model that we had an opportunity to visit and see, and not only speak to the folks that are running the program, but to see firsthand how people are moved from despair, addiction, houselessness, to long-term recovery. And that, I believe, is what Chair Smith is dedicated to, Commissioner Savas, Commissioner Schull, and Commissioner West, and myself. I think that is what we're dedicated to having in this county. And I will say that there is an issue with communities of color that do not have oftentimes as much access. So as we move forward with this model, we also have to acknowledge that and know that our Latinx communities, our Russian community, our other communities out there need to also be considered to make sure that we give them the access they need to what we can provide for community health. So thank you all for coming tonight, and thank you, Chair Smith.
Thank you, Commissioner Schrader. Ben West, you're next.
I decided to run for the Clackamas County Commission because I couldn't help and sit on the sidelines from my previous position as a Wilsonville City Councilor. I want to be a county commissioner because public health is distributed at the county level. And as a nurse and a local elected, I wanted to not just care at the bedside, but bring the care that was needed in the community and to help bring policies and solutions that I was not seeing from other local leaders or from the city of Portland or out of Salem. We can see with our own eyes that for far too long, there's been a lot of promises and failed policies, but we haven't been creative and innovative enough to step outside that echo chamber and to do things a little bit differently. And I am proud of this board because we are trying to do that. And we're trying to make that effort as a group and as a team, and really be creative and think outside the box. It is creative to say in the Portland metro area that recovery is possible, because for far too long, it's been an endless cycle of addiction, despair, Narcan, endless despair, Narcan, endless despair, getting high, ODing, getting high, ODing. It's been a washing machine. Just that's what happens, and there's no hope. And we're hoping to build out a care continuum here in Clackamas County that's duplicatable, that's evidence-based, that is accountable to outcomes, that helps people be treated and have their needs tailored to, that treats them as individuals and patient-centered, no matter where they come from. Addiction and homelessness is not inherent to one socioeconomic group or one group of people. It is a human crisis that we are facing in our home right now and with our neighbors. And so it's all hands on deck. And so I'm really proud of the work that this board has done. And just to recap really quick, in a recovery-oriented system of care, it's about community. And bringing all those community resources, the business community, the faith community, the local governments, the school systems, all on board to say we're all stakeholders in this, and we're all going to make sure that we have that we all do everything we can to solve this crisis in our own local communities. So it's about prevention, It's about awareness campaigns. We need shelter beds to help people get stabilized. We need medical detox. We need substance abuse detox. We need economic supports for people. We need to allow them to get in a place where they can not have to worry about surviving, so they can worry about thriving, and have those other things be their goals and take baby steps towards recovery, and provide them a safe place to do that over a long period of time. And that is where we're putting our resources in Clackamas County. And we've already started to do that. And there's big things potentially around the corner that we can't wait to talk even further about, where it's not being done in the metro area, but we're going to look to do big, bold things here in Clackamas County. While also dealing with the policy realities that are making the problems worse, like Measure 110. Clackamas County, I believe, has put itself on the map to be a leader in this issue throughout the entire state of Oregon, and people outside the state of Oregon are looking at Clackamas County and its leadership in this space. The Measure 110 questions, other counties that we're posing that Chair Smith spoke to, other counties across the state are looking at adopting those questions to help put pressure on the legislature and on the governor to stop abdicating their role or nibbling around the edges to solve this problem. I think that shows a lot of local leadership. A number of cities and counties have passed our recovery-oriented system of care resolution in their own counties, because the truth in it rings true to them, and they are looking for something that they can take and move forward with, because they have experienced this a lot of failure, and they were looking for a system that actually helps solve the problem. And so Clackamas County showed leadership there. And then how we roll out our services, how they're patient-centered, and how we are accountable to that system of care, I think has been evident up to this point. So we have a big crisis to solve here. I think we're looking for big solutions in Clackamas County, and this town hall is just one of those. So thank you everybody for coming and listening today. Nami, thank you for your participation. It's great hearing from you, and other people who provide services. Simon from Parrot Creek, you guys do phenomenal work, specifically with the youth and those that are in our foster care system. And others that have spoke about Pam Pierce, prevention in our school system. There's a lot of people in our community that care about this, and this is a big issue to them. So we're listening to you, and thank you for participating tonight. We look forward to working with you in the future.
Okay. Thank you all. If we've heard anything tonight, is the needs are great, and we know the needs are great. And we hear you, and we're going as fast as we can to create a system that works. We are starting a new mental health clinic over on Lake Road. We purchased a building to do that. We have the stabilization center that the sheriff requested, a 23-hour stabilization center that keeps mental health people in jail because they don't belong there, to figure out what we need to do with them next. There's another navigation center starting. We have multiple nonprofits who are making large investments in long-term recovery. We will invest in a long-term recovery facility. And I think we're dedicated to doing that. We're just not ready to say where it is yet. And two, the private sector has come on board with their own places to house people. Like I say, the needs are great. And Mary Mama said it best, maybe it'll never be enough, but we hope so. But I want to thank everybody who participated tonight. We appreciate you all. You all gave us good insight. If it didn't seem like we didn't answer your questions, we're going to be sending out emails. I just asked Dylan if he could do that in a couple of the instances. So with that in mind, Dylan, I'm going to turn it over to you.
Thank you very much, Chair. That is all the time for tonight. So for Clackamas County, for the Board of County Commissioners, for Mary Rumbaugh, thank you again. Have a good night.
Good night.
Good night, everybody.
Good one.